We do have some time left for people who would want to make comments or raise questions at this point before we are dismissed. Any final thoughts or comments, suggestions for the forum, for those of us who are continuing on in this endeavor, this paradise built in hell? We're there? Enough in?
Just a quick question. Can you, oh, I'm sorry.
Go to the mic is all I'm asking, Dick. Sorry. I didn't mean you had to leave.
Brian alluded to some suggestions for the series of workshops that are about to happen. What can you share about your current thinking about those workshops?
Do you wanna speak? Yeah.
So I think the next workshop, we had a very active dinner last night, and I think that what we're looking at are planting and harvesting some of the alternative ways that people have done that with evidence-based interventions and programs. So tentatively, there's going to be an hour discussion about it after, but potentially looking at some system models from some other countries, maybe some European countries, Brazil, and/or an Asian country. Really getting CMS, PCORI, and other funding streams that would be likely or potential platform promoters for evidence-based interventions. Third, really looking at the consumer perspectives, and consumers we defined here as we had some state policymakers as well as federal and local, but that could be families, providers, getting a broader range of providers. Then some of the people that specifically that we know are harvesting in alternative ways would be Bruce Chirpita, Charles Collins from the Centers for Disease Control, whose Centers for Disease Control's model about replicating evidence-based programs has evolved over the last 20 years, and they have a lot of experience in it. And Hendrix's team is doing modeling of effects of randomized controlled trials, harvesting knowledge in different ways. And then we have a panel on methodology, Naiwa Dwan about alternative design strategies, then the randomized controlled trial, David Moore, technological strategy, technological innovations for strategies. So this, I think, is the tentative outline of an agenda, and where the feedback from you came to be much more interactive and maybe a little less packed and more allowing for discussion. We've talked already just structural issues like changing the chairs so that you're on slanted rows with this team here so that there would be more of an interactive process. And that's our tentative short-term goal, while I think the long-term goal is quite ambitious, and I would turn to Bill or Hendrix to comment on the overall sixth session.
I would say we welcome your suggestions and your ideas. And we're trying to think about innovation and challenging paradigms, and we certainly hope that this will go beyond 6 sessions. There are many forums that go on for years, so that we can have this as an ongoing place for dialogue and interaction. Hendrix, do you want to add anything?
So with that, I think I'll dismiss the group and tell you that you are free to go, and thank you all for coming.